I just wanted to talk about the fact that there's a lot of attention that's been paid to the physical health toll that COVID-19 has taken on the population here in the United States. And I think people are also aware of the psychological toll that it is taking on many people across the country. I think kids have a certain special way that COVID has impacted them, and the toll continues to be pretty substantial on the childhood population in this country. Um, Research by APA, Mental Health America, has painted a picture of increased need for services, increased need for crisis intervention, and those things aren't necessarily going to go away because of vaccines or returning to school or election results or anything like that that we're all thinking about and concerned with right now. So what we're really focused on is trying to help people um, to be mindful of different ways that they can positively impact children's mental health. And at large nonprofit hospitals, like where I work here in Columbus, Ohio, we rely on behavioral health funding through charitable organizations because it's an underfunded and under-resourced area of service. But we also know that mental health and physical health go hand in hand for lots of kids. So we rely on donors and on organizations like Children's Miracle Network who help fund some of the programs and some of the innovation that we're trying to use for population level education and resources, as well as research and new treatments for mental health in children. And so there are really two ways to impact the disparity between the number of services that are available and the need for those services. And that difference has only grown in the past 9 months. We've always lagged behind with the type of services and the amount that we can provide versus the demand, but it's grown a lot in the past 9 months. And so we're seeing a surge or an increase in desire for those services and the need for them. And so the two ways that we can think of to impact that system, one is to provide more and more efficient services to children who are experiencing mental health concerns or who need therapy or treatment for some reason. And so we work on that through training and education of providers, through novel treatment strategies, through research and evidence-based treatments as well. But the other way is to impact it on the front end through a preventative strategy. And that's where my program on our sleeves really functions, is we try our best to impact children's mental health as early and as frequently as possible so that when they're young and learning about how to manage things like their emotions and how to process disappointment and how to develop resilience, that we're teaching parents, teachers, other educators, and people who work with children, as well as directly children themselves, strategies for improving all of these skills. And so we're hoping that down the line, we're preventing the need for some services in kids out there.